epicenter of the COVID-19 pandemic lifted its lockdown on April the 8th. China's tough decision to isolate the city succeeded in slowing and then stopping the fast-spreading virus in its tracks and gave the world time to prepare. Sadly, by then, COVID-19 had already spread around the world. And what happened in Wuhan is now happening in other parts of the world. So, what are the lessons to be learned? What is the experience of lockdown like in other parts of the world? That is our topic. This is Dialogue. I'm Zhou Yue.
今天10时起，全省城市公交、地铁、轮渡、长途客运暂停运营。
The Italian Prime Minister has announced restrictions on movement across the entire country.
Everything is empty. It's like you can hear a pin drop out there. It's very surreal. It's like one of those movies that you think, and now I think we're in that. So, but it's a good ending.
We've come to embrace the term social distancing from the Centers for Disease Control. That means avoiding group gatherings, plus crowded subways and buses.
Well, the Wuhan lockdown shocked many people around the world when it was announced. Our ancestors were familiar with isolation and quarantine, but the world has not seen a lockdown of this magnitude in modern times. How did residents in Wuhan and other similar cities cope with the inconvenience and emotional toll? First, let's turn to a Wuhan resident, Wang Zhongkai, from Beijing University of Posts and Telecommunications, and a D.C. resident, Kate Seeley, from the Middle East Institute. So, Zhongkai, I understand that you study in Beijing and you returned to Wuhan for the Chinese New Year and got stuck there. What is it like over the past 3 months?
Well, sure, there was a panic in the beginning. As a matter of fact, I had a surgery and stayed in hospital for 1 week in the middle of January. Well, thankfully, my doctor told me and my family to put on masks while we were in the hospital. And I got home on 20th, the same day that Professor Zhong Nanshan arrived in Wuhan, and people start to realize the series of these situations, and the whole city began panic. Well, my panic cannot reach a peak in the New Year's evening. I still remember the feels of powerlessness and despair. Well, however, the things got changed pretty soon as the Huoshenshan and the Leishenshan hospital were built, and all the doctors and supplies from all over the country, even all over the world, gathered in Wuhan. And well, the panic gradually disappeared, leaving only gratitude and being proud to be Chinese.
But what is your life like? Because with the lockdown, there are very limited transportation. You can't go outside for grocery shopping. How can you carry on?
Well, for the food and supplies, well, we will order the food online once a week, and thanks for the community, they has really done a pretty good job. They are making sure that everyone can order fresh vegetables, meats, or other supplies. And when it's arrived, my father would go downstairs and pick them up at the gate of our community. Well, I'm now taking online lessons, and my parents are both handling their jobs through the internet. These days, the situation are getting controlled, so we are able to go down and take a walk around the community. And I even got my haircut a few days ago.
Good for you. I was told that you have done some filming of the city during the lockdown. How did you manage to do that? And what have you found?
Well, yes, I've been taking some photos and videos of the city, mostly through my bedroom's window or around the neighborhoods. Well, I'm just trying to let the outside world know what really happened down here in Wuhan. And the truth is the government and the volunteers, all the people in Wuhan are trying their best to keep the whole city running. The LED lights, for example, they are still shining in the evening, and the volunteers, they are trying their best to make sure the supplies arrive in time, and the doctors, of course, all of them are trying their best.
All right. Keep on your learning online. Thank you very much.
Thank you. Thank you.
And now let's turn to Kate Seeley in the United States. Well, Kate, what were your initial reactions over Wuhan's lockdown? Some say this is a lockdown unprecedented in history.
Well, our reaction was that probably they were doing the right thing, that in order to stem this pandemic, we were learning people needed to self-isolate and quarantine. So we watched Wuhan from afar, very impressed by how they were managing this lockdown, but not quite aware that these same requirements might be asked of us just a few short weeks later. So here we are in Washington, D.C., where our own mayor just issued an order, a stay-at-home order on April 1st. And it's indefinite, so we're starting to get used to this new era of social isolation as well.
How would you describe stay-at-home in the United States?
Well, it varies from state to state. I'll talk about our experience here in Washington, D.C. Our stay-at-home orders ask that we only go out for essential activities, which include grocery shopping, going to the pharmacy, going to the hardware store, going to see a doctor, going to the hospital. So under that stay-at-home order, we're able to get out. Because also it includes exercise. We're allowed to exercise. So those streets are quiet. There are not a lot of cars out on the weekends and in the afternoons. You do see people leaving their houses and running, biking, walking, just getting out as much as possible. It's springtime here, thankfully. And I think, after 8-9 hours of sitting at home at your desk, people are desperate to get out and get some fresh air. So I have to say it's a bit crowded in our parks. Yeah. People are banned from gathering, and playgrounds are closed, and basketball nets have been taken down. But there are lots of running trails, and everybody's congregating on these running trails. So it's interesting seeing people trying to give each other that 6 feet of social distancing that's required when you're nearby. And as a result, I think people are starting to wear masks for the first time in the United States.
That's interesting, because here in China, everybody wear masks. But it seems initially in Europe and America, the authorities didn't advise people to wear masks. But now it has some shifts.
Yes, correct. I would say, just a week ago, people sort of discouraged others from wearing masks, because masks are in such short order, and the order was, all masks should be reserved for the, for the healthcare system. But it was on Friday or Thursday that the CDC finally came out and said, look, we recommend people to wear masks because, up to 25–30% of people carrying COVID are asymptomatic, so we don't really know who's got it. So we think a mask, is an important, form of protection. So there's suddenly this new online cottage industry of homemade masks, from cotton that can be ordered. Medical masks are very hard to get.
Okay. Keep up the good work. Thank you very much, Kate.
Thank you.
And you're now watching Dialogue here on CGTN. And later on, we'll talk about how doctors and medical workers have been responding to COVID-19.
我说潘多拉的盒子已经打开了，然后灾难、恐惧、疾病这些都跳出来了，然后但是这个盒子里面最后的一样东西，就是我们看这个希腊神话里面他说的就是希望，只要希望还在，那么之前的所有这些 都不会是问题。
When you arrive at this point, you realize that you are not enough, and maybe we are 100 anesthetists here. We are doing our best, but maybe it's not enough.
It's 5 a.m. I'm in the middle of my overnight shift, and we've just intubated a patient who's in his mid-50s. He's going to the ICU, and one of the really bizarre and unnerving things about this illness is that it makes you alone.
And Wuhan's battle to stop COVID-19 would not have succeeded without the tremendous sacrifice made by the doctors and nurses and the mobilization of the entire country to help contain the epidemic. Over 3,000 medical staff members have been infected in China, and many more are being infected around the world. To learn more about their sacrifices and work, we're now joined by Liu Yuanli from Peking Union Medical College and Dr. Megan Rani from Brown University. So, Mr. Liu, people are wondering what kind of a challenge is it for the Wuhan doctors and nurses fighting in the front line in January and February? Could you please describe us what kind of work is it?
You know, this is a new virus and new disease. So there requires, of course, learning by doing. So the first line of fighters are the doctors and nurses. And because due to lack of understanding and knowledge about this disease, so they, of course, run a lot of risks. For example, and very few doctors realize that they got infected because they are working in the non-infectious disease departments. And of course, with the rapid rising of cases, because Wuhan, after all, is the epicenter of this outbreak, and the healthcare system in Wuhan became, in a very short order, overwhelmed. So doctors and nurses had to work on shifts, and they are exhausted. And also due to lack of supply of PPEs. So sadly, some of my former classmates, because I graduated from the Wuhan Tongji Medical University, have fallen. So they paid prices and sometimes with their lives to learn the very important lessons, how to deal with the diseases, and not just on the public health arena, but also on the day-to-day clinical management situation.
And Megan, did you notice what was happening in Wuhan in January and February? And were doctors and medics in the United States back then thinking about, wow, this might happen here?
Absolutely. We were watching very closely what was happening in Wuhan, following the stories about both the types of patients that were presenting for care, but also the degree to which the medical profession was, as the other guest described, putting itself at risk. The high proportion of healthcare workers who were getting sick and dying. And those early reports out of Wuhan really served as the basis for a lot of the medical practice that we're using now in the U.S. to try to take care of these very sick patients. The early data and strategies for treatment that were used in Wuhan have become the core of much of what we do as we continue to try to grow the evidence base and the science here in the United States.
What kind of a strain are the medical staff in the U.S. and are working under? Why they're still working on a lot of strain? Is it because underprepared or because the shortages of medical supplies?
It's really about the shortages of medical supplies and the lack of a systemic preparedness. So although those of us who are medical professionals noticed and paid attention to the COVID-19 outbreak in Wuhan and started getting worried very early on about what this would mean when it came to the United States. It wasn't if, right? It was a question of when. Despite our concern, there really was not a federal level preparation early on. And so now the position that we're in is that individual states and hospital systems have been doing their best to prepare, but we simply don't have the national level stockpiles for protective equipment that are needed.
And Professor Liu, back in January and February in Wuhan, actually a lot of help poured in. The entire nation was mobilized. After the breakout confirmed, medical supplies and teams and donations from other parts of the country rushed into the city. How was that helpful to deal with the pressure in Wuhan?
You know, it's absolutely necessary and critical for the lockdown strategy to really work, because Wuhan, you know, as the epicenter of this COVID-19 outbreak, it's not just simply a lockdown preventing people from leaving the city. It's how to deal with those confirmed cases. You know, the whole healthcare system in Wuhan got overwhelmed, and so the city and the province really need help. And luckily, they got the help in short order, and the central government made a decisive decision to send more than 300 medical teams, more than 42,000 doctors and nurses to Hubei, to Wuhan, to help out. And almost overnight, 16 temporary hospitals, so-called Fangchang shelter hospitals, were built to take care of all the confirmed cases, to provide the treatment and support.
And Megan, the sad news is that the number of new infections in the U.S. is still soaring. Do we see the curve being flattened anytime soon, the end of April, early May? And does much more testing still need to be done?
We are beginning to see the curve flatten in places like Washington State. It seems that deaths are starting to stabilize in New York City, although it's too early to call that truly hopeful. We've seen some hopeful signs from California, as well as other states that put these social distancing rules in place early. However, we're also seeing new hotspots rising up. Detroit, New Orleans, Texas, and other areas of the United States that were later or had more difficulty in putting those social distancing guidelines in place. I do also want to emphasize the need for more testing. As the other guest emphasized, that testing is critical so that we can identify both who has the virus and is sick versus is sick for other reasons, but also so that we can identify those asymptomatic carriers who are the ones that really go and spread COVID-19 around the community. We do not have adequate testing in the United States right now, and we desperately need greater numbers of tests, widespread testing across our community. You know, my own home state of Rhode Island, we've just rolled out 2 new testing centers in collaboration with CVS, which is a big drugstore chain here, as well as with our National Guard, which I'm hopeful will make a difference for my state. But, you know, we have 50 states across the United States, and people travel across borders all the time, so we really need this to be expanded nationally.
So you and your colleagues are aware that you're going to be working on a lot of stress in the coming months?
We are so aware that this is the tip of the iceberg for us in the United States. Day by day, we are seeing increasing number of patients with COVID-19 symptoms who need to be hospitalized or put in the intensive care unit. We are waiting for those replenishments of supplies to come. We are trying to follow the breaking science so that we can take the best possible care of our patients. We're also seeing our colleagues get sick, get hospitalized, put in intensive care, and even for some of them watching them die. So the stress and anxiety, but also the resolve, are very strong among healthcare providers across the United States right now.
All right. Thank you so much, Megan, and hanging in there. Thank you, Mr. Liu. In a short break, we'll come back and reflect on what the policymakers should take away from this public health crisis.
While we have faced challenges before, this one is different.
It's the biggest crisis we are living in since the Second World War.
So all over the world,
It's incredible what's happened in such a short period of time.
This is not a financial crisis. This is a human crisis. What is needed is a large-scale, coordinated and comprehensive multilateral response.
We're now engaged in a global learning process, and the world still have to seriously address the human, social, and economic impact of outbreaks and health crises. For insights on global governance, we're now joined by two experts, Dr. Elisabetta Grappelli, a virologist of St. George's University of London, and Professor Howard Foreman from the Yale School of Management. Elisabetta, as an Italian working now in London, I think you have an overview of the situation in Europe. Of course, the continent is undergoing high levels of infection and hospitalization, but was Europe not able to learn anything from the outbreak in Wuhan? Because that was the story in January in the city of Wuhan.
I think Wuhan and China, and when I say Wuhan and China, I mean both the authorities but also the people, have shown Europe that social distancing and travel restrictions really are successful when it comes to reducing virus transmission. However, we need to remember what actually Europe is. Europe is a constellation of individual countries, and all of the countries are actually taking their own decisions when it comes to public health, when it comes to an emergency response. They've also been hit individually at different times by the virus. But most importantly, all the different European countries have different resources that they can use to combat the epidemic, on the pandemic. And
but isn't the European Union supposed to do the coordination work and allocate resources in times of crises?
That some of that has definitely been going on, and actually Italy has just received an entire personal protective equipment shipment from China that actually has been allocated to Europe, but then Italy was identified as the country needing it most. So there is some of that for sure. However, it's actually down to the individual countries and the individual governments to actually make the decisions about, for example, testing, about lockdown, what kind of travel restrictions or what kind of severity of lockdowns actually needs to be put in place.
The Chinese government has been doing very stringent quarantine and the lockdown of a whole city of 11 million people. But people say this kind of policy cannot be copied by other governments around the world. Different governments have different social contexts. Do you agree that the different countries should have different approaches, or there is a universality in some approaches?
From my point of view, I think each country has their own set of rules and regulations and laws that they must follow, so each country is going to have to respond in a different way. I think many of us in the United States were heartened by the fact that South Korea seemed to go through a lockdown without even having to have a lockdown, because people were experienced enough from MERS and from SARS to immediately recognize the threat that this represented. I think in a lot of other countries that had not experienced the fear from a infectious disease spreading rapidly, I don't think they knew what to expect, and so I think you see a lot of other countries that were delayed in their tactics.
When this is over, what do you think are the biggest lessons we can learn in terms of building up a sound public health system, a epidemic monitoring and control mechanism?
Yeah, I think that from the United States point of view, what we learned is that coordination at the federal level has been lacking, and we need to do far better with that in the future, both in terms of having access to supplies, access to ventilators, testing, to be able to stand up a testing system very, very quickly, and being able to do testing, tracking, and tracing efficiently, detecting cases efficiently. We could have mitigated, if not completely contained this substantially, if we would have been more aggressive and more attentive a couple of months ago, and I'm certain that we will do better in the future.
And Elisabetta, the European, it seems they're still troubled about their different response speed and methods. How can they do better if there is a wish to band together and work from the same page?
I think it will be both in terms of strengthening the individual national response, because this pandemic has highlighted the weaknesses of individual states, but it has also highlighted how collaboration actually is helpful. And in this particular sense, again, I go back to my country, Italy, and many patients that have required intensive care units have been transferred to Germany. So support and facilitations of this kind of top-end collaboration will be absolutely crucial, and possibly we need to be formalized a little bit better to make sure that next time, because as a virologist, I know that there will be a next time, we are much ready. But I guess this is also highlights not just at the European level, but also internationally.
Yes, indeed. We should see this as a wake-up call for all of us. Thank you very much, Elisabetta, and thank you very much, Howard. But those who cannot remember the past are condemned to repeat their mistakes. In 2020, the world is reminded painfully of those words said 100 years ago. It started as a Wuhan story, but is actually a universal human story, a sobering and humbling experience. When a mysterious deadly virus broke out, people were initially at loss. How bad is it? What should we do? And what if we did not? That is what happened in Wuhan in January. But the signs became clear. It was a new virus. It had spread to humans, and it could spread fast. Wuhan was locked down. The largest quarantine in history kicked in, and frontline health workers scrambled to treat patients lining outside hospitals. But the rest of the world failed to pay attention. Despite warnings from the WHO, Europe and America still imagined that the virus is not their problem, and they were blind to blow-by-blow accounts of Wuhan frontliners fighting fatigue and desperation. The virus reminds us how vulnerable we are, and even worse, when we wear lenses of bias and bigotry, we are more susceptible. There is so much point in sarcasm in the changes of our behaviors. Now we act as if everybody has coronavirus, and we keep away from each other. But this is a time more than ever that we need to keep it together amid the fears and the loneliness. Now our instinct is to lie low, but we ask the best of us to put their lives on the line. Now we expect our countries to be selfish and left alone, but actually no nation can deal with this on its own. It makes sense now to fight our instinct and reach out with bravery, vision, and perseverance. I myself spent most of my life in Wuhan, the epicenter of all this. My hometown has been devastated by the virus medically and economically. 3 months later, we know we can beat this. The people there still worry about a comeback of the coronavirus, but they know better, and they're not afraid. My families and friends in Wuhan told me they're on the move again. They felt the pain, they fought the plague, and they embraced life regained. And here is the world should also listen to.
So